The surprising benefits of Ozempic, beyond blood sugar control. The landscape of metabolic health treatment underwent a dramatic transformation in 2023, with semaglutide medications, including Ozempic, Wegovy, and Rybelsus, generating an unprecedented $38.6 billion in US sales. As we move through 2024, these numbers are expected to climb even higher. While these medications were initially developed for blood sugar management, healthcare providers and researchers have discovered several unexpected beneficial effects that extend far beyond their primary intended use. These surprising outcomes are reshaping our understanding of how these medications can benefit patient health across multiple systems. Remarkable advances in kidney protection. One of the most significant discoveries about semaglutide has been its exceptional impact on kidney health, particularly in patients with chronic kidney disease (CKD). While researchers anticipated some positive effects given the medication's success in diabetes management, the actual results have far exceeded initial expectations. The groundbreaking FLOW trial, which involved 3,533 participants in a randomized, double-blind study, revealed that semaglutide reduced major kidney events by an impressive 24% over approximately 3.5 years when compared to a placebo. The impact was so significant that it led to an unprecedented decision by Novo Nordisk, the manufacturer of the drug. The company chose to terminate the trial ahead of schedule following recommendations from the Data Safety Board, which determined it would be unethical to continue giving some participants a placebo when the benefits of semaglutide were so substantial. This early termination of a clinical trial is a rare occurrence and underscores the magnitude of the medication's positive effects. The kidney benefits appear to stem from multiple mechanisms. While researchers are still working to understand the complete picture, current evidence suggests that semaglutide's anti-inflammatory properties play a crucial role. The medication also appears to improve endothelial function and may offer direct protective effects on kidney tissue. Perhaps most importantly, patients receiving semaglutide showed a notably slower decline in kidney function and experienced a 20% reduction in all-cause mortality, suggesting far-reaching benefits beyond kidney health alone. Breaking the chains of addiction in what may be one of the most unexpected developments, semaglutide has shown promising effects in reducing cravings for various addictive substances, including alcohol and nicotine. Recent research from 2024, examining data from over 1.3 million patients across the United States, revealed remarkable results in addiction reduction. The study found that patients taking GLP-1 medications experienced a 50% decrease in alcohol abuse rates and a 40% reduction in opioid overdoses. These findings were further supported by additional research involving 83,000 patients with obesity, which demonstrated that individuals taking semaglutide had a 50% to 56% lower incidence of alcohol use disorder compared to those using other anti-obesity medications. Similar results were observed in a separate study of nearly 600,000 patients with type 2 diabetes, suggesting that these benefits extend across different patient populations. The science behind these addiction-fighting properties appears to involve semaglutide's interaction with the brain's reward system. The medication influences key areas such as the ventral tegmental area and nucleus accumbens, potentially dampening the rewarding effects of alcohol and other addictive substances. Additionally, the drug's effect on slowing gastric emptying may contribute to these benefits by reducing the rate at which alcohol is absorbed into the bloodstream, thereby diminishing its immediate rewarding impact. Anti-inflammatory properties and pain management. The anti-inflammatory effects of semaglutide have emerged as another significant area of interest. The medication works through GLP-1 receptors found on T cells, which play a crucial role in immune responses. Research has shown that semaglutide can reduce levels of pro-inflammatory cytokines, including TNF-alpha and Illinois-6, leading to a decrease in systemic inflammation throughout the body. These anti-inflammatory properties have practical implications for pain management, particularly in conditions like osteoarthritis. A recent multinational study published in the New England Journal of Medicine demonstrated that semaglutide provided significant pain relief for patients with obesity-related knee osteoarthritis compared to a placebo. This finding opens new possibilities for managing chronic pain conditions, especially in patients who may also benefit from the medication's weight management properties. Protecting the brain, new hope for neurodegenerative diseases. While effective treatments for neurodegenerative conditions remain limited, semaglutide has shown promising potential in this area. Although the medication doesn't readily cross the blood-brain barrier, it concentrates in the hypothalamus, potentially contributing to various beneficial effects on brain health. Animal studies have demonstrated particularly encouraging results in models of both Parkinson's disease and Alzheimer's disease. In Parkinson's disease models, semaglutide has been shown to improve several key aspects of brain health. The medication appears to enhance mitochondrial function, reduce the loss of dopaminergic neurons, and improve motor function. Similarly, in Alzheimer's disease models, treatment with GLP-1 medications has led to reduced amyloid beta plaque formation, decreased neuroinflammation, and improvements in both learning and memory functions. These promising results have led to the initiation of human trials to further investigate semaglutide's potential in managing these devastating neurodegenerative conditions. While it's too early to draw definitive conclusions, the preliminary results suggest that semaglutide could potentially play a role in protecting brain health and possibly slowing the progression of these diseases. Cardiovascular protection. Beyond weight loss, the cardiovascular benefits of semaglutide have been well documented in patients with type 2 diabetes, showing consistent reductions in heart failure and other cardiovascular events. However, what makes these findings particularly interesting is that these beneficial effects appear to occur independently of the medication's impact on weight loss and blood sugar control. The presence of GLP-1 receptors in the vascular endothelium and myocardium suggests that semaglutide may work directly on heart tissue. This direct action appears to reduce fibrosis, improve blood flow, and slow the progression of atherosclerosis. A 2024 meta-analysis examining 13 clinical trials with over 26,000 participants demonstrated that semaglutide significantly reduced C-reactive protein levels compared to both placebo and other glucose-lowering medications, regardless of diabetes status. Furthermore, a multicentric placebo-controlled trial focusing on obese patients with cardiovascular disease but without diabetes revealed that the cardiovascular benefits of semaglutide began to appear shortly after treatment initiation, even before patients experienced significant weight loss. This suggests that the medication's cardioprotective effects may be direct rather than solely a consequence of weight reduction. Implications for clinical practice. The discovery of these additional benefits has significant implications for healthcare providers and their approach to patient care. When considering treatment options for patients with diabetes or obesity, the potential for semaglutide to simultaneously address multiple health concerns makes it an increasingly attractive choice. For many patients, this could mean a reduction in the total number of medications needed, as one medication might effectively address several health issues simultaneously. However, it's important to note that while these benefits are significant, semaglutide may not be appropriate for all patients. Healthcare providers must still carefully consider individual patient factors, including medical history, current medications, and specific health goals when determining the most appropriate treatment approach. The growing understanding of semaglutide's multiple beneficial effects represents a significant advance in metabolic health treatment. As research continues and more data becomes available, we may discover even more ways in which this medication can benefit patient health. This expanding knowledge base allows healthcare providers to make more informed decisions about treatment options and potentially improve patient outcomes across multiple health domains.